Hello and welcome to the session. 6.13 I International Healthcare Policy LO2. Understand the social and cultural context of healthcare. How do social and cultural factors shape healthcare experiences? This video explores the profound impact of these elements on health outcomes and service access. Discover why understanding this context is vital for effective healthcare delivery. Social factors like income and education directly impact health. Lower socioeconomic status often leads to poorer health outcomes. Limited resources and unhealthy living conditions exacerbate these issues. Healthcare systems ignoring these factors risk widening health inequalities. Recognizing social determinants is crucial for equitable healthcare. Culture shapes attitudes towards health and healthcare. Beliefs about illness and treatment vary widely across cultures. Family decision-making and religious beliefs can influence healthcare choices. Disrespecting cultural differences may lead to patient disengagement. Culturally competent policies are essential for quality care. Language barriers can hinder healthcare communication. Misunderstandings may arise from unclear diagnoses or treatment plans. This can lead to reduced treatment adherence and poorer health outcomes. Providing interpreters and culturally appropriate information is crucial. Training staff in cultural competence enhances healthcare delivery. Stigma and discrimination shape healthcare experiences. Groups facing prejudice may avoid seeking help. This affects trust in healthcare providers. Understanding social dynamics can challenge bias. Inclusive care requires acknowledging these issues. Culture influences health-seeking behavior and treatment acceptance. It affects communication and decision-making in healthcare settings. Misunderstandings can arise from cultural differences. Respecting cultural beliefs is key to effective healthcare delivery. Culturally sensitive care improves health outcomes. Society impacts healthcare through social structures and economic conditions. Socioeconomic status affects health outcomes and service access. Demographic changes influence healthcare demand and planning. Social inequality and exclusion shape healthcare experiences. Education and health literacy also play crucial roles. Socioeconomic status significantly impacts health. Poor housing, nutrition, and limited access to information are key factors. These conditions increase healthcare demand and create access barriers. Deprived areas face higher pressure without adequate resources. Addressing these issues is essential for equitable healthcare. Aging populations increase demand for healthcare services. Long-term care and chronic disease management are key areas. Service planning must respond to demographic trends. Failing to do so creates service gaps and longer waiting times. Effective policies are needed to maintain quality care. Social inequality shapes healthcare experiences. Discrimination and stigma discourage engagement with services. Unequal access reinforces existing health inequalities. Tailored services are essential for diverse populations. Addressing inequality improves healthcare outcomes. Education affects healthcare outcomes. Higher education levels improve health information understanding. Poor health literacy leads to misuse of services. It increases emergency care use and reduces treatment adherence. Addressing educational disparities enhances healthcare effectiveness. Attitudes shape healthcare access and outcomes. Trust in systems affects service use and treatment adherence. Responsibility views influence health behaviors and funding support. Attitudes to prevention impact population health. Understanding public attitudes improves healthcare effectiveness. Trust impacts healthcare access and outcomes. High trust increases service use and early diagnosis. Low trust leads to avoidance and poorer outcomes. Past experiences and media coverage influence trust levels. Building trust is key for effective healthcare delivery. Views on health responsibility affect healthcare engagement. Personal responsibility encourages healthy behaviors. State responsibility increases service demand. Balancing these perspectives is crucial for effective healthcare. Policies must consider cultural and political influences. Attitudes to prevention shape healthcare outcomes. Positive attitudes encourage screening and vaccination. Negative attitudes increase preventable illness. Cultural beliefs and misinformation influence these views. Promoting prevention improves population health. Attitudes to mental health affect service use. Stigma discourages help-seeking and delays treatment. Positive attitudes improve access and early intervention. Cultural norms and generational views shape these beliefs. Addressing stigma enhances mental health outcomes. In the UK, healthcare is shaped by social values and cultural diversity. Socioeconomic inequality affects health outcomes and service demand. Cultural diversity influences healthcare delivery and patient interactions. Public attitudes towards the NHS are generally positive. Addressing inequality and cultural barriers is vital for effective healthcare. Socioeconomic inequality impacts healthcare in the UK. Deprived areas face higher rates of chronic illness. Barriers like limited literacy and unstable employment affect access. This creates inconsistent engagement with NHS services. Addressing these issues is crucial for equitable healthcare. Cultural diversity affects healthcare delivery in the UK. Different beliefs about health and treatment influence patient interactions. Views on mental health and decision-making vary widely. Culturally insensitive care leads to disengagement and mistrust. Providing culturally competent care is essential for positive outcomes. Public attitudes towards healthcare in the UK are generally supportive. The NHS is seen as a collective responsibility. Rising demand and service pressures challenge this view. Media coverage and personal experiences influence confidence. Addressing service quality is key to maintaining public trust. Social stigma affects healthcare attitudes in the UK. Mental health and disability are key areas of concern. Fear of judgment delays help-seeking and reduces policy effectiveness. National campaigns have improved awareness. Continued efforts are needed to address stigma and improve outcomes. In conclusion, understanding the social and cultural context of healthcare is essential for delivering effective and equitable health services. Social factors such as income, education, and community support, along with cultural beliefs, values, and traditions, significantly influence health behaviors and access to care. Recognizing these contexts enables healthcare professionals and policymakers to design services that are culturally sensitive and responsive to diverse populations. This understanding supports improved patient engagement, health outcomes, and inclusive healthcare delivery. Thank you for watching this video. If you have any questions, please feel free to contact us via email or WhatsApp at 07484361688.